So once the barium enema is complete and all of your images have been taken, you can now evaluate your images. We started the exam with the scout image, which is basically a KUB. You got your kidneys, ureter, bladder, ureter's bladder, pubic symphysis up to the diaphragm. Very nice KUB image. A technique for the KUB or for the scout image is about 120 kVp at about 25 mass, 20-25 mass. So after the scout image was taken, you tipped the patient, you called in the radiologist. The radiologist did the fluoro study. After the fluoro study was complete, he had you take some overhead images. The first overhead image we shot was the right lateral decubitus. You know it's the right lateral decubitus because the patient's laying on the right side, the left side's up. You got barium listening to gravity here. You got barium on the lateral side of the ascending colon as well as the medial side of the descending colon. So that's a good right lateral decubitus there. Also centered at the iliac crest as well as the mid-sagittal plane. And a technique for the right lateral decubitus, I would use 120 kVp at about 25 mass. So after the right lateral decubitus, we went on to shoot our lateral rectum. So here's our lateral rectum. There's our rectum there, plus the distal end of the sigmoid colon. This was centered at the as-is as well as the mid-coronal plane. And you can clearly visualize the rectum there. We shot the lateral rectum at 120 kVp at about 60 mass. So after the lateral rectum, we went on to shoot our oblique. So we put our patient in RAO position. So you got the right side down. So you can visualize the ascending colon as well as the right colic flexure or the hepatic flexure. So you got barium in the hepatic flexure there. Technique for this, I would use 120 kVp at about 32 mass. Also centered at the iliac crest and 1 to 2 inches from the midline towards the elevated side. The rotation for the oblique is again 35 to 45, not 35 to 40. So after our oblique, we went on to shoot our PA. For the PA, you visualize the whole colon as well as the sigmoid, a little bit of the rectum there. This is done to visualize the whole colon. So you are again centered at the iliac crest as well as the mid-sagittal plane. A technique for this, I would use 120 kVp at about 25 mass. So after the PA, you went on to shoot your PA axial. For your PA axial, you have a 30 to 40 degree caudate angle on your tube. You're centered at the as-is as well as the mid-sagittal plane. A technique for the axial, you will need to go up a little bit, so 120 kVp at about 40. So this is done to visualize a sigmoid colon as well as a rectum. Good axial image there. After the PA axial, you went on to shoot your other oblique, which is the left oblique, or the oblique for the left side. So you're able to visualize the left hepatic flexure as well as a descending colon. It's a very good oblique image there. Like once again, centered at the iliac crest, 1 to 2 inches from the midline towards the elevated side. Good image there. A technique for the LAO position, oblique, 120 kVp at 32 mass. So after the oblique, you went on to shoot your left lateral decubitus, which is right here. You have the left side down. You got barium on the lateral side of the descending colon and the medial side of the ascending colon up here. Got the right side up. Left lateral decubitus, once again, centered iliac crest as well as the mid-sagittal plane. Technique for this again, 120 kVp at about 25 mass. So once you finish taking your left lateral decubitus, you're going to shoot your final image. You allow your patient to defecate, use the restroom, come back, and then you shoot your post-evac image. So this is basically a PA once again, centered at the iliac crest, mid-sagittal plane. Technique 120 at about 20-25 once again. And this is post-evac. So after they use the restroom, you will have this image here. Once again, instruct your patient to drink a lot of water. If their stool is white color, it's okay, it's normal. Don't be alarmed, and just remind them to drink plenty of fluids, plenty of water to drain the barium out.